PPH protocol scenario. You're delivering a grand multipara, gravida 7 para 6, and after the delivery of the baby, the patient started bleeding. How would you manage this case? Okay. So first of all, whenever I see that the grand multipara who has just delivered a baby is bleeding, so my first step would that be call for help. So I will call the senior midwife, the obstetrician anesthetist, the staff nurse, and each and every colleague around me for help. I will alert the hematologist as well because we may need the blood transfusion. I will alert the blood transfusion laboratory. I will alert the consultant obstetrician and on call. And at the same time, I will start the resuscitation. First of all, I will assess the airway, then the breathing, then the circulation, and I will apply the oxygen mask of about 15 liter. I will maintain the fluid balance, in which I will give the 2 liter of the isotonic crystallite, 1.5 liter of the colloid. Then I will do the blood transfusion. I will arrange the ORSG negative or group specific blood, and also I will ask one of my junior to arrange the FFP, platelet, scribe precipitate, and factor 7A, and I will keep the patient warm. At the same time, I will do monitoring and investigation. For that, I will ask the staff nurse to put 14 gauge cannula on both sides and take blood for full blood count, coagulation, urea electrolytes, and LFTs. I will cross match 4 units and FFP along with the platelets and crystallites. I will use the ECG and pulse oximeter. I will pass the Foley's catheter. I will do hemoglobin bedside testing, and I will arrange the blood products. I will consider the central and arterial lines. I will commence the record chart. I will weigh all the swab and estimate the blood loss. At the same time, I will start the medical treatment, in which I will rub up the uterine fundus. I will empty the bladder. I will give 5 unit oxytocin slow IV and repeat if necessary. If available, I will use the ergometrine of 0.5 mg slow IV or IM. I will give the oxytocin 40 units in 500 ml and carboprost 0.25 mg IM every 15 minutes up to 8 times. I will give carboprost intramyometrial of 0.5 mg. I will use the misoprostol of 800 microgram sublingually. I will consider the tranexamic acid 1 gram IV. And before going to theater, I will consider 4D. In the theater, I will check is the uterus contracted or not, and I will prepare patient according to WHO surgical safety checklist, and I will check whether the uterus is contracted or not. I will do examination under anesthesia, and I will check has any clotting abnormality been corrected. Then I will use the intrauterine balloon tamponade, the brace suture, and consider interventional radiology. Then I will start the surgery, stepwise uterine devascularization, the bilateral internal iliac artery ligation, and hysterectomy by second experienced clinician, and uterine embolization. Then I will shift the patient to high density units or intensive care units. I will commence on the thromboprophylaxis and hematology if possible. Then I will debrief the husband, family, and complete the incident form and debrief the team.